Hello, everyone. Welcome. My name is Carrie Sipp. I'm the Director of Nonprofit Partnerships at Creating Healthier Communities, CHC, Creating Healthier Communities. We exist so that every person in every community has an opportunity to live their healthiest life. We're a national nonprofit helping organizations achieve their missions by bringing communities, nonprofits, and businesses together. Our goal is to improve the health and well-being through collaboration. And with our unique approach, we work closely with partners to create scalable, sustainable solutions that drive real lasting change. And we're so glad to have you here for our Navigating Health and Policy Shifts Insights for Nonprofits First Creating Healthier Communities University event. And now I'm going to introduce Jean Axius, our CHC President and CEO, who will say a few words and introduce our esteemed guest, Luke Hartig. Thank you, Jean, so much.
Well, thank you so much, Carrie, and good morning, good afternoon, depending on where you are. I am extremely excited and delighted to have this opportunity to welcome Luke Hartig, who's going to be presenting some amazing insights. We know that for the last couple of weeks, particularly for those in the DC area and across the country, if you're working on health issues or have a health grant, or thinking about ways to partner with the federal government, there's been so many different shifts and changes and pivots. And I think we're all wondering exactly where are we? Where are we headed? And how can we best serve our beneficiaries? How can we best serve those we care so deeply about? And this webinar could not be more timely. Just earlier this morning, we saw the breaking news that the Department of Health and Human Services is restructuring and consolidating some agencies and also thinking about ways to reduce their workforce. So the opportunity to come together as a community, the opportunity to understand exactly what does these shifts mean for the people we serve, for our communities, and for the organizations we represent is extremely timely, relevant, and much needed. I am deeply honored to actually introduce Luke Hartig. Luke is the president of Gravity Research. He leads Gravity's research and consulting businesses, including the Stakeholder Influence Analysis, the Societal and Reputational Intelligence Service, and the Political and Reputational Vetting Service. Prior to joining the National Journal, Luke served as a senior director at the National Security Council in the Obama White House. He previously served in a range of government roles, whether that's at the Pentagon, the State Department, the Office of Management and Budget, and the Government Accountability Office. Luke began his career as a Peace Corps volunteer in Guatemala. He holds a master's degree from Harvard University and then a bachelor's from Boston University. He is an adjunct fellow at the New America, an executive editor of Just Security, and a member of Advisory Council for Hostage US and the James Legacy Foundation. Luke lives here in Washington, D.C. with his wife and two amazing sons. He is a father and a husband, and I'm sure someone who's trying to really understand exactly where are we and where are we going as a nation when it comes to health, healthcare, and health equity. So with that, please help me in welcoming Luke, who's going to share his slides. Luke?
Gene, thank you so much for the warm intro. Really appreciate the partnership with CHC. We had a great chance to talk to Gene and the rest of the CHC board last 2 weeks ago, I guess. And so this conversation really kind of grows out of that conversation. And I always start these conversations with really gratitude for everybody for taking the time to join us today. I know you all have busy days, and I want to be a good steward of your time and make good use of it. Before I jump into the content for today, I want to just take a moment to introduce my colleague, Anu Bhatt. Anu is on the line with us. As Jean suggested with my background, I have a background that is not in the healthcare space. I impersonate a healthcare expert every day in my job. Anu actually is a healthcare expert. So Anu has worked for a number of years in a range of healthcare positions, including for us doing amazing work here at Gravity Research, but also in the immunization space as well. So a lot of really great insights on this and really the intellectual architect of this work that I will present today. So what I'd love to do for today's conversation, maybe just set a little bit of a frame, is we will be primarily talking about DEI and health equity issues as they're playing out in the early days of this administration. A lot of the data I'm presenting will be corporate data. There is some nonprofit stuff in there, but a lot of the initial impacts that we're seeing, and certainly what a lot of our clients care about, is what's happening in the corporate space. However, we know that this is pretty quickly affecting a broader range of actors in the healthcare space, everything from the big corporate players to community health organizations, nonprofit hospitals, et cetera. So working through all of that. So we track for 90 plus of the biggest organizations in the world, the range of societal and reputational pressures that they face, whether that's on things like DEI, LGBTQ rights, reproductive rights, climate and sustainability. We're kind of constantly tracking those issues. I will say that DEI has been the most pressing issue we have received from our clients and in our research over the last, not just since President Trump was inaugurated, but really the last probably 6 months or so, just a constant risk area. We also do a stakeholder influence analysis. That's really going deep on the people who are driving policy. In this administration, as with the first Trump administration, this is kind of a constant challenge because President Trump has brought in so many kind of not DC insider types, right? Slightly unconventional players where we need to be able to analyze where they're coming from, what makes them tick. For the purposes of today's conversation, a lot of that is the research that Anu and my team has been doing on the MAHA movement and what that looks like. And then we do a lot of work around kind of like vetting political candidates and others in the space. That work is less relevant for today's conversation, but it's part of what we do here at Gravity Research. So with that overview of who we are out of the way, let's actually dig into the meat of the conversation. And again, my overall frame here is how the administration's early actions are affecting DEI and health equity, and some potential ways ahead for folks across the healthcare space, the nonprofit space, et cetera. So I'd love to just do a little bit of an overview of DEI. And actually, let's go to the next slide so I can, I think I have an agenda in there. Perfect. A little bit of overview of the DEI actions early on and what we think that means for DEI and health equity. Talk a little bit about how companies and major institutions are responding. Go deeper on health equity and MAHA specifically. And then talk a little bit about just how some of the changes in language and emphasis are starting to take root across the space, including a little bit of benchmarking data from some of the more prominent healthcare associations at this point. So let's dig in and start with the first slide. And let me just talk about DEI writ large and how this administration is thinking about it. So if we go back to the affirmative action decision, I think it was 2 years ago now, since that affirmative action decision, there's been and I should pause there to say, affirmative action decision from the Supreme Court affected universities and public institutions. It did not affect corporations. However, it was a ruling under Title VI of the Civil Rights Act. And we know that historically, what happens in Title VI pretty quickly lays the predicate for cases that can be put forward under Title VII, which does affect corporations and private institutions. And so a number of activists looked at the affirmative action decision and said, hey, this is actually groundwork for us taking broader action on DEI against corporations and other players, right? So that's kind of the initial frame. And so what's happened since then? Well, one, you've seen the rise of a number of well-funded legal activist groups. The most prominent two being a group that's led by Ed Bloom, who is the architect of the affirmative action litigation, and another one led by Stephen Miller, who is now President Trump's deputy national security advisor. So incredibly well-placed individuals who have been leading a robust legal campaign against DEI efforts across the corporate space over the last 2 years. Combine that with a large amount of online activism, and that is online activism focused on calling out companies and institutions and universities over their DEI practices, trying to cite the outsized cost of those efforts as leading to organizational underperformance, whether that's stock price or just general underperformance, right? And relying on whistleblowers who could point to various components of DEI that they believe are being hidden or otherwise sort of sneaking into how organizations are approaching DEI. So those tactics are now being embraced with the full force of the federal government behind them. We're seeing the Department of Justice, for example, suggest that they are going to go after companies. The FCC is investigating Comcast right now for their DEI practices. We're seeing the government actions fueling the actions from outside anti-DEI activists and going after companies. And we're certainly seeing the use of whistleblowers inside the government. So let me get down to brass tacks. Like, what does that actually mean for organizations at this point? Well, there's about half dozen EOs, and I'm vague about the numbers because DEI pops up in so many different EOs, executive orders, but there's about a half dozen or so, 6, 7, 8 EOs that directly pertain to DEI. And a lot of what we see in them is either a political statement, right, meant to show that President Trump is taking action on this issue, or it directly affects the government and federal contractors. And so that's like the biggest push that we've seen so far, right? So things like ending federal DEI programs and training, mandating so-called merit-based hiring, abolishing federal equity grants, et cetera, banning affirmative action in the contractor space, increasing government oversight. So again, most of that it pertains to government grant recipients or federal contractors or the government itself. However, there is a provision in one of the executive orders that calls on agency heads to identify up to 9 organizations that may be in violation of civil compliance around DEI. Put in other words, arguing that there is still, quote unquote, illegal DEI activity happening, and agencies identify that and refer that information to the Attorney General for potential investigative action, right? Now, when this first came out, we heard from a lot of our clients, as well as an executive panel that we built here at Gravity Research, that, hey, I thought, whatever reputational risk might be out there on DEI, I think legally we've de-risked it. We've already run our programs through our lawyers, and we feel like we're on the right side of the law. And that initial reaction, however confident people might have told me that they were feeling, it actually has created a lot of chilling effect across the community. So we recently did a survey, and we found that 74% of corporate executives say that their top up at night challenge in the Trump administration so far is the threat of federal DEI investigations. So that's breaking through, and we're going to see more action from the Department of Justice and the EOC, Equal Employment Opportunity Commission, how those two bodies will interpret some of the DEI guidance and potential regulatory or litigation action against companies. Right now, like I said, I think the risk is particularly acute for large companies, but also for large institutions, foundations, universities, et cetera, since those seem to be the ones that are kind of most at risk and most cited. There's also, I think, a certain amount of risk that comes from not the government itself, but from this relationship that the government has and this administration has with anti-DEI activists, especially online ones, who will use and amplify the government's actions to their benefit, right? And indeed, we've already seen some of this from Elon Musk, for example, citing things that Doge has identified that he believes are the worst excesses of DEI or other programs that he opposes, and publicizing those on Twitter. So we're seeing a lot of that, and I think that will kind of continue to be a real challenge here, and companies are watching out for that. Overall, I think that there is a sense of like, hey, let's keep our heads down and see what happens here. There is also, though, a growing sense that the pro-DEI crowd will start to emerge and apply pressure on institutions to hold their ground. And indeed, we've already seen some of that from Reverend Al Sharpton and his National Action Network that is going after companies, but also really trying to shore up companies like Costco that have really held strong on DEI. So that's kind of the initial state of play when it comes to DEI. But let's jump from DEI specifically and zoom in a bit more on health equity and what that looks like. What I would say about health equity is that it has not yet become the center of the focus of this administration, right? So certainly there are elements of, if you did the Venn diagram of DEI and health equity, there's a fair bit of overlap, and anything that's labeled equity per se, or that might be support to particular populations, et cetera, will certainly be under scrutiny from the administration. However, we haven't seen like a policy per se on what used to be referred to as health equity in the previous administration emerge in the context of this administration. What we're seeing instead is a much more kind of piecemeal approach to various things. So, for example, withdrawal from the WHO, World Health Organization, foreign aid pause and review of some of these global health programs like PEPFAR, and then more broadly thinking about how and regulating how healthcare providers can engage in this space. So, limiting gender affirming care for youth, allowing ICE enforcement at hospitals, ending some of the ACA enrollment extensions and support programs, right? So the sort of cutting down on some of the health equity focused access issues that have been happening in the previous administration. And then finally, just this broader kind of crackdown on federal funding, right? Whether that's federal healthcare grants, the cuts to NIH, et cetera. Again, it's not for us, we're sort of a little bit of putting pieces into a puzzle that don't fully fit insofar as this is not like a broader specific anti-health equity campaign. It's a whole bunch of pieces that I think are coming together. Nonetheless, if you look to the right side of the slide, they do have the effect of disrupting your existing health equity frameworks, and not even just health equity, but even broader concepts like social determinants of health, and all of that we think is like pretty heavily disrupted. We also think that the federal funding freeze, and especially some of the actions at NIH, really threatens some of to create greater disparity in healthcare research. And so that's a piece that we're watching very closely there as well. And then finally, we're worried that some of the action on DEI could really result in a widening healthcare workforce shortage. Again, a number of both the DEI actions at medical colleges and elsewhere, as well as immigration policies, were intended to expand the number of providers and also providers who can serve certain at-risk communities. And some of those we believe are likely at risk based off of what we've seen on DEI so far. One area that we talked about a bit with Jean and the team 2 weeks ago is what happens with the combined federal campaign, right? This initiative where federal employees can designate charities that they want to be able to donate to. And this has been an incredibly effective program for a number of nonprofits to receive kind of small dollar donations. We have not seen any indication as of yet that the CFC would change their criteria to exclude certain types of groups. Traditionally, the CFC has been pretty inclusive about the number and the types and the stripe of groups that they permit to be part of that. However, with some of the cuts to the federal workforce and uncertainty about further cuts, I think we would expect to see overall receipts and donations in the CFC declining. But we're just continuing to watch that because I know that is an area that's of concern for CHC. Let me say a little bit more, flipping back to DEI, how companies in particular, but I think you can extend this to some of the broader institutions, are responding. So first of all, it's not just the government, right? We continue to see conservative legal groups that are filing action against DEI, citing litigation, reputational, and financial risks. And that's happening among legal activists. It's also happening among proxy votes and essentially large shareholders. And so far, there have been companies that have made significant rollbacks of their DEI efforts. However, there have been others who have cited DEI as being good for business. It helps them with their talent pipeline. It helps them serve the communities where they are most present. It's a broader interest area for investors and the such. But, I think in either case, we are not seeing a large-scale turn back from commitment to inclusion and belonging. We are, though, seeing an effort to de-risk their programs in a way that they are not legally out of compliance or legally subject to litigation. That's kind of the biggest thing that we've seen is that effort. And we've seen a real move away from talk of equity, systemic racism, historic injustice. A lot of the larger rhetoric that defined the era of 2020 and 2021 when there were major commitments that were being made on DEI. So just a little bit of some of the reactions so far. I think in the we don't have data up here. What we've seen from like universities, universities have been tough. Some are certainly holding the line, talking about this being good for an inclusive academic environment and creating opportunity and advancement, all of which are central to the mission of a university. And at the same time, some of the concessions that Columbia had to make are on DEI, right? And other universities that might be targeted by the federal government are more likely, when faced with the threat of substantial funding cuts, to actually walk back some of their DEI commitments as well. And let me just say a bit about how we're seeing the health equity conversation unravel. And this particular slide, let me just set a little bit of context here. This is our look at how the health equity conversation trends online. And what we've done is we have an index of several thousand influencers. When I say influencers, these are online influencers, they're academics, they're journalists, they're policymakers. And we actually segment them like these are climate people, these are health people, et cetera. And this is just to look at the things that have sort of driven conversation over the last few months. So there's been like a real focus on health equity as it pops up, but it depends on the issues that are actually emerging. So obviously a lot of chatter around RFK when he was first tapped for HHS secretary, a lot around kind of government funding issues, the Trump EOs as well. So each of these have kind of led to some sort of a surge. You'll see here that our data for this chart, which is a few weeks old, cuts off in early February. Since then, we've seen a lot of conversation around the employee layoffs across federal health agencies and temporary injunctions pausing implementation of NIH funding cuts. We've also seen a lot of focus around vaccines and vaccine hesitancy around RFK and some of his changes to the vaccine advisory committee meetings. And then a lot of conversation around the response to the measles outbreak in Texas. So no real surprise there, but just to show you the types of things that seem to be capturing the imagination of some of the most plugged in people in the health policy space. And so MAHA, Make America Healthy Again, what is this movement? Let me start first by saying I think that there are, depending on how you slice it, kind of 3 or 4 big camps of people who are driving healthcare policy and filling key agency positions in this administration. The first one is kind of core MAHA. And what is that? That's RFK and his immediate universe of influencers and allies and colleagues. These are people like Casey and Callie Means. They're people like Del Bigtree. These are all people who came up in the anti-vax space around vaccines and autism, especially for pediatric vaccines. They're people who've been very concerned about things like seed oils and in their view, corporate corruption of the food supply. And they are very much in kind of a pop science space, but very engaged on that range of issues. The second group, which is very closely related to this, is just sort of the celebrity doctor type, right? So Dr. Oz is a great example of this. Dr. Nishewat, the nominee for Surgeon General, another great example of that, Fox News contributor, et cetera. And they kind of, are less kind of ideologically aligned in a particular space, very open to sort of some of the MAHA conversations, but also engaged with a broad range of healthcare influencers. It's not a huge camp in this administration, but something that we're definitely watching. The third big camp is what we would call the COVID dissidents. And these are people like Dr. Bhattacharya, Dr. Makary, who really felt like the public health consensus on COVID did not allow for any dissent. And furthermore, that those who dissented would see their careers and their reputations ruined. And they are upset about this, bitter about it, you might even say, and really want to make sure that there is room at the table for dissenting voices when it comes to major public health issues. These people, though, are incredibly well credentialed, right? If you look at the CV of Dr. Bhattacharya and Dr. Makary, I mean, incredibly accomplished individuals, but definitely have that COVID experience hanging over them. And then the final camp, which I thought we would see more of early in the administration, but are not seeing as much of, and if to the extent we're seeing this camp, it's a little bit more at the lower levels. This is kind of the Trump 1.0 people who are coming back. So think of like Brian Blase, who runs Paragon Health Institute. Think of Joe Grogan, who was a White House health policy influencer in the first term. They are mostly traditional GOP health policy influencers, definitely very technocratic, definitely very much in the weeds, definitely the kinds of people who know the ins and outs of the Medicare and Medicaid programs. We just have not seen a lot of them actually in positions of power as of yet. So that's my overview of the actual groups. What are we actually seeing so far when it comes to engagement on core issues? So a lot of what RFK Jr. is doing early on are things that he's basically promised he was going to do, right? He's a longstanding critic of alleged conflicts of interest in NIH research funding, hence some of his efforts against NIH funding so far. The termination of staff across FDA, CDC, others. This is something that RFK Jr. called for last year, right? So kind of reducing the overall enterprise. One thing that Gene asked us about and that we've spent a lot of time thinking about is like, where are there areas of overlap between what the MAHA movement wants to do and what have traditionally been concepts that might fit within health equity or social determinants of health? And there's not a lot. However, two spaces that we really see some overlap is on rural health and physician shortages. So let's talk about each one of these in turn. First of all, on rural health, Project 2025 was very focused on telehealth to reduce personnel costs, to serve veterans, but also really to expand care to rural areas. This is something they talked about quite a bit. RFK Jr. has talked about using innovation like AI and telemedicine to assist rural communities, and that's something he brought up and highlighted during his confirmation hearings. A number of members of the Congressional MAHA Caucus are strong proponents of rural healthcare, and that's a big part of it as well. And then when it comes to provider shortages and physician shortages writ large, this is something that RFK Jr. has talked about quite a bit. He's proposed expanding funding for training of addiction care, for example, among primary care physicians, partly channeling his own experience with addiction and driving that. He and others have championed chiropractors as providers of holistic health, and they can help us with some of our provider shortages. And then there are a number of people in the MAHA movement who are doctors themselves who have talked about the challenges of physician shortages. And then finally, a space that's just a little bit more of a question mark for us at this time is RFK Jr. and some of the thinking about clinical trial diversity. He's indicated some support, for example, for basic tenets of clinical trial diversity and supporting tribal inclusion in research. And there has been a lot of discussion about, the gold standard of science within the MAHA movement. It's just a little bit hard to pin down exactly what that actually means when it comes to specific support for particular elements of clinical trial diversity, and that's something that we've been watching very closely. First of all, peer actions. So this was something that Gene had asked us to look into to say, how are other organizations talking about this administration and about healthcare policy writ large? And I'd say two things. First of all, most organizations are not talking about MAHA and its specific needs much at all, right? So they are not responding directly to administration's actions. To the extent that they are engaging, they're engaging on concepts like patient access and preventative health. So again, not the specific elements that were particularly relevant on health equity. There are probably two big notable exceptions here. The first being AAMC, which has and continues to be quite vocal in challenging the attempt to slash NIH funding. And they are part of the lawsuit challenging that directive in court, which resulted in that nationwide injunction. The second is the APHA, which launched a new health equity initiative quite explicitly in opposition to the Trump administration actions that brings together officials from some of the agencies most directly impacted. The initiative is called For Our Health, and in their words, it intends to, quote, champion optimal, equitable health and well-being for all. But I think what we're mostly seeing is, again, a focus on things like patient access and prevention. We're seeing a focus from organizations like pharma about innovation and the importance of continued innovation in our healthcare system. So that seems to be the reading the room and saying, hey, this is more the space that we think might be palatable to this administration rather than some of the concepts we've been talking about for the last couple of years. We are hearing from our clients, and we serve a broad range of major healthcare partners. We are hearing a fair bit of concern on our calls and emails, et cetera, from our clients about the potential impacts of Trump executive orders on DEI in particular, on health equity initiatives that are often core to their business. So what does that mean? For example, clinical trial diversity initiatives for a pharmaceutical company. There's a lot of concern about how these things would impact these companies as well as federal contractors. And there's so many groups in this space that are major federal contractors. And so that scrutiny, that anxiety is definitely popping up quite a bit across this space. So I'm going to go ahead and just hit 30 seconds on the final slide. I know we're running a little bit short on time. I don't want to sugarcoat it, right? Like, it is a tough environment for health equity. And that's a pretty notable shift from this administration. If I had to really focus on where there's some opportunity, I think the opportunity is in rural health. It's in physician shortages, and it's in framing things around patient access. I think those are like the winning potential ways through this. Again, I acknowledge that if you've been working on health equity, that feels like weak tea, but those are the places where we think that there's still some potential opportunity. So I'm going to stop there. I know folks have questions. Happy to take those. I'm going to pause and take a drink of water.
Great. Thanks, Luke. We know that you also mentioned that the administration loves the word prevention. We got health access, prevention, holistic, and rural were kind of big takeaway words. And so from our meeting 2 weeks ago, so those are good words for us to keep in mind as well. We do have some questions for you and Jean, and thank you, Anu, for joining us as well. Given Project 2025 support of telehealth to fill service gaps, what's the latest on removing state-based licensing barriers?
Yeah, I'm going to phone my friend Anu on that.
I think there's still a lot of interest in this, but I do not know that we are really seeing anything majorly changing here on the licensing barriers. But happy to come back to you guys, with an answer on that later on.
Here's maybe an easier one. What health programs are the Trump admin and GOP Congress likely to fund?
Yeah, great question. I mean, I think a lot of it is going to be, I mean, the specific programs, I think there's still a lot of kind of figuring that out. And part of that has to do with the fact that the people who've been appointed to these top positions, again, are not necessarily people who have decades of experience actually living inside the federal programs, right? So there's a little bit of like familiarizing and learning everything out there and figuring out how it aligns with their broader perspectives. And I think that's actually an opportunity for a number of organizations. You have a group that's less likely to be knowledgeable about some of the ins and outs of federal health care policy, but also less likely to hold on to some of the long-held opinions that others in this space might have. So I think there is a bit of opportunity in there. I mean, so far, again, I think the rural health has been such an overarching piece that's kind of come through again and again that I would imagine that remains kind of front of mind. But Anu, I don't know what else you would cite in terms of like specific programs that we've seen them favoring so far.
Yeah, I don't think we've really seen like calling out, this is a great program. We want to keep that, quite to the extent that we might have seen, I think, from other administrations who would come in. I think one thing to flag here, though, is, just mentioned it earlier, the big reorganization that happened, that was announced this morning around HHS, the new administration that's being created, the Administration for a Healthy America, that's going to bring together HRSA, SAMHSA, the National Institute on Occupational Health, as well as the Office of the Assistant Secretary for Health. One of their focuses here, obviously, is understanding and preventing and treating chronic disease, but they specifically mentioned in several articles an increased focus on healthcare resources for low-income Americans. So that can definitely be, an area that has some potential, and also just sort of that cross-cutting implication to, a variety of different communities who would be impacted by socioeconomic status.
Great. Thanks. And then this kind of leads us into an area that creating healthier communities is very focused on: Medicaid cuts. What are the predictions around that? That's the $64 cajillion question, especially for people who are relying on Medicaid.
Yeah, that's a great question. I mean, I think that, and this was an issue we talked about when we met with CHC a couple weeks ago. I think there's still a lot of figuring that out, right? And certainly, and I think what you're seeing is like a push and pull within the administration, right? So you've got Elon Musk and the Doge crowd who, as they're working through their various cuts across the government and things that they believe are superfluous spends of U.S. money, they also are now starting to move into the entitlement programs, right? And Social Security is the first target, and the focus so far has been rooting out waste, fraud, and abuse, which most credible researchers say is an extremely small percentage, something like 0.3% of total Social Security expenditures, but nonetheless something that they're focused on. You're seeing kind of a broader allegation that these programs are really set up, and Elon Musk has repeated this several times, to benefit undocumented immigrants and ultimately to buy their votes, right? So essentially to create a class of dependent citizens who therefore will vote for the Democratic Party. And that's something he's repeated again and again, and certainly has certain resonance among his supporters. However, we've also seen a pushback from Steve Bannon, who is not necessarily a close ally of Elon Musk, saying that they're going to have to realize that there are a lot of Trump voters who are on Medicaid. And cutting Medicaid is going to have political repercussions for the president. So I think we're in the middle of that bit of push and pull at this point. And I think we're still seeing how that would sort out, but that's kind of the current state of play. But Anu, again, anything you'd add on that?
Yeah, I think nothing major to add there. I mean, I think I just doubled down on Luke's final point there, the implications for the GOP in, heavily cutting Medicaid would be, very intense. And now we do have statements from, more conservative members of Congress like Josh Hawley saying, anything further than, adding a work requirement is just not going to be a viable option for me. That's, something like 20% of my state is on there. So I think, you're also seeing a greater acknowledgement of that impact within certain senators and members of the House.
Okay. And one last question, because I know you guys, we're squeezing down on time here, but how can we continue to do the effective, impactful work? Babies are not red or blue. Children are not red or blue. How can we continue to do the impactful work on infant and early childhood-based work when we're limited so by our wording and our messaging?
Yeah, it's a great question. I mean, I think there's a couple of things I would say, and the work we presented here is really just the beginning, I think, of what should be a process. Like, one, what are the things that they really talk about? And when I say they, it could be RFK and his allies and people in the administration, right? It can also be Steve Bannon and others in this space that we know are prominent outside influencers. Language matters. Language matters a lot. Language matters a lot to this administration in particular, and framing things in a way that it fits with some of their broader language narratives, I think is really powerful. I think the second thing is, like, unfortunately, we're in such a politicized time, right? It's such a, I think if you saw the president's speech to Congress, there was a lot of sense of not reaching out to his opponents, not having this view of, hey, the election's over, I'm the president of all Americans, but really being pretty vindictive of anybody who might oppose him politically. And I think that's just a reality. That's a reality of where we're at. So I think being able to tell the stories in a way that it speaks to a broad range of people, including people who are pretty squarely within the Trump coalition, is really important. And I think a big part of it, a big part of successfully navigating this administration. I wish it were different. I really do. But this is kind of the environment we're in. And I think finding that kind of framing the messaging, the right messenger that appeals to the particular coalition power, I think is probably the best way forward.
Great. Thank you so much, because we really got it. Words matter. Prevention, rural, holistic. Those were some of the big words that we got. So we know that you are going to need to take off, Luke. We so appreciate your being here with us. Anu, your colleague, is going to stick around with us.
Great.
And now on this part of the presentation, we hope you're going to stay, because we're going to share a little bit about how, now that we know we're going to need to do 3 times as much with half as much money, right, Gene Axios? I mean, that's the deal. So thank you, Luke. And so that's where CHC comes in, because we are creating healthier communities. We impact about 5,000 nonprofits a year through workplace giving. We have 650 corporate partners with which we work. We've created these relationships, and we welcome more corporate partners so that we can take workplace giving campaigns directly into corporations so that they can impact the area in which they work. And we work very closely with them in several different ways. We had people at a Hilti event earlier this week talking about pain, a manufacturing company where we put together a program for them on pain. We also impact them. We touch the lives of between 17 and 21 million people through workplace giving. A large chunk of that comes through what Gene is going to talk about next, which is the combined federal campaign. And of course, that's the thing that has people concerned, because what's going to happen with workplace, with cuts in staffing, and the fear associated around that. So we are bringing these businesses, these nonprofits, and our community partners together. And we'll go to the next slide. Jean is going to give us a good overview on CHC. And thank you so much, Jean. Thank you, Tyler. Thank you again, Gravity.
No, thank you, Carrie and Tyler and Luke and Anu. This has been an amazing conversation. And part of what we're doing at CHC, as Carrie mentioned, given our partnership with the nonprofit sector, given our partnership with many, many businesses, and really serving as a bridge and a connector to really ensure that the community voice and the community lens and the community lived experience is at the center of everything that we actually do. I could not be prouder of this team and the work that we're doing to provide and to elevate a lot of strategic insights and intelligence so that we are equipped with adequate information so that we can really think about the strategies moving forward in order to be impactful and really meet the needs of the people and communities that we actually serve. As Carrie mentioned, CHC is actually a founding partner of the Combined Federal Campaign, which was established in 1961. Since that time, we have raised over $8.6 billion to charities. And the goal here is really to work very closely with the employees, with the organizations, with our nonprofit partners to ensure that we're matching what employees want to contribute to the organizations that matter most to them. As a result, we've been working very closely with OPM over the years, both in terms of the work that they've been doing to do outreach with their coordinators, as well as to think about how we can further modernize and ensure that the donors who are contributing to CFC, that the dollars that are raised are actually going to the nonprofits that they care so deeply about. We've been very fortunate through our strong relationship with OPM to be able to bring OPM, the leaders from OPM, to the virtual stage in terms of doing teletown halls. We've been doing them for quite some time, and we meet regularly with the OPM team. We have several of our leaders who are actually at CHC who sit on various councils and foundations to represent all of the nonprofit partners that Carrie highlighted so well. In addition to that, we know that because of our way of engaging with our nonprofit partners, understanding the different donor preferences and how that evolves by generation, and then of course our marketing apparatus, we've actually seen that our CHC partners actually fare much better than other nonprofits participating in CFC through other organizations. So really thinking about the work that we do here at CHC, like these type of town halls, the webinars, the CHC University, the customization, the marketing, the strategic analysis, and the data analytics that we have to really position our nonprofit partners in a very good light to be able to receive as much dollars as possible in order to expand their mission. In addition to that, as you can actually see from the work that we've been doing, and even throughout today's conversation, we're a multi-sector organization. We believe that no one sector can actually solve these challenges in isolation. It really does take a partnership. So with our ability to work with our nearly 5,000 nonprofits, our ability to engage nearly 650 businesses, and of course, the work that we're actually doing at the community level, we are bringing all of those to bear to really address the barriers to health and to ensure that every single person in every single community has an opportunity to live their healthiest life. That actually shows up in terms of events, convenings, thought leadership conferences that we actually host. We believe very strongly in engaging the workforce, whether that is in the for-profit or nonprofit sector through our volunteer projects and our purpose platform, which is a tremendous way to give back while also improving your own overall health. Because of the work that we're able to do within CHC and across the organization, we have the capabilities through our partnerships to really do the assessments that are needed at the local level, both understand exactly what are the assets in a community, what are the opportunities to take the lived experiences and preferences of the community, and really map that out in a way to really close some of these gaps. And of course, I just mentioned our ability to provide capacity enhancing and capacity building support, whether it's serving as a physical sponsor or providing financial management or grant making capabilities or the fundraising that we're actually able to do. And that's just a sample of what we actually do here at CHC. I think that this really just kind of demonstrates, again, some of our programmatic initiatives through our partnerships and some of the initiatives that we've been able to do. And you heard earlier from Luke and also from Carrie, some of the work around maternal health and vaccine equity and the whole 9 yards. But I just wanted to just kind of highlight how we are bridging that gap, working in partnership with our community-based organizations and our nonprofit partners to really drive systems change. And as you heard from Carrie and Luke, one of the areas that really focused on is ensuring that the Medicaid program, which serves over 83 million people, 1 in 5 Americans are actually on the Medicaid program. And we've launched a Medicaid Diaries, which is an opportunity to really help elevate the lived experiences of individuals who are on Medicaid. This impacts businesses, this impacts families, this impacts communities. And we want you to join us in this effort to ensure that we're preserving the Medicaid program. It impacts most, if not all, nonprofit organizations as well. So with that, one of the key things I just want to leave you with is the fact that we're in an environment where partnership is key, where trust is actually essential. And that is what CHC actually brings to the table through these partnerships, through these discussions. We want to hear from you. We want to know how we can be helpful and relevant to the work that you do each and every day. And I'm going to turn it back to Carrie, who's going to walk us through how that might show up. Carrie?
Thank you so much, Jean. So we can go on to the next slide, because here is where we're talking about doing twice as much or 3 times as much with half as much. And America's most trusted nonprofits trust us to help them do this. And here is why. Because they raise more funds with our networks, that we're the CHC is the single largest recipient of combined federal campaign funds, raising millions each year through workplace giving. We work with some of the most incredible nonprofit partners. I work personally with 19 $100 million and up nonprofits, and then all the way down to nonprofits and communities that maybe have one employee, or not even one employee, but are run by a part-time volunteer. We will connect your organization. If you run a nonprofit, if you're on the board of a nonprofit, if you donate to a nonprofit that you love, we can connect your nonprofit with all the eligible campaigns in your area. The corporate campaigns as well as the state campaigns. We're in 38 states running campaigns with state employees. So we can take care of everything. We have our brilliant compliance team that can help with getting you compliant with those statewide campaigns. And we will put the information at your fingertips. We have leveraged the heck out of technology with our charity partner portal to connect you with donors and financial reports. And Shelby Spath, who runs our help desk, is there. For those of you who know her, you can attest to the fact that this woman really is consistently present and helpful to you to get you the answers that you need. But when donors share with us their information, we can help connect you to your donors so that you can start forming those all-important relationships with them and help you steward your donors. And then I know we have questions about the fees. You only pay a fee on the registration, on the states in which you are running a campaign, and on the net funds raised. And the campaigns themselves dictate oftentimes what the percentage is going to be. On average, it's about 13%. The first year that people are involved, the campaigns involved with us, is free. This is a long game. Workplace giving is a long game, though it's shorter because we have so many corporate partners that our nonprofit partners can get into their campaigns more quickly. So about registration fees, it depends on what states you're going into. We do want our nonprofit partners to be 501c3s, to have 990s, to have anti-discrimination board agreements, and ideally to have an audit, but some don't. So it depends on what the states need. So we would love for you to fill out our leads form. If you look at the QR code there in the corner, that will take you to the lead form so that you can learn more about becoming a CHC partner. We have a streamlined enrollment process. As I say, this is not an instant gratification. All of our partners reapply to be in campaigns in the fall. So we will put you into our mailing list and get you started on the application process. But you can come into the mailing list and start participating with us now, but the applications to be in campaigns will happen in the fall. So we will help you with your application services, financial reporting, donor data, marketing support. We do a tremendous amount of social media, volunteer programs, and campaign continuity and optimization, and more. And we met with someone this morning who gave us some new ideas about ways that we can help our nonprofit partners. We've been around 70 years. This is our passion, is to support nonprofits in the good work that they do to create healthier communities. And then finally, and we'll let you ask us some more questions, I just want to do a little nod to what's coming up. This is our first CHC University, our first Creating Healthier Communities University. And it was created to help our nonprofit partners grow revenue and become more financially secure themselves so that they can create healthier workplaces themselves. We know the workplace drives ill health in communities. Conversely, since we want to look to the positive, the workplace can drive health in communities. And that's what we want to help our nonprofit partners do, so that they can model healthy workplaces in their communities and help bring other organizations into creating healthier workplaces, that they become even more equitable, better places to work, and then give them the support in creating healthier communities. So we're going to be offering these events. Go ahead and mark your calendar on the third Thursday of each month between 12 and 1. And we will offer these events to everyone. We will send recordings to our nonprofit partners. And we're very excited about what we've got coming up on April the 24th at noon. We are going to be discussing leveraging the science of the positive to grow your organization and create healthier communities. Dr. Jeff Linkenbach from the Montana Institute, who is the father of the science of the positive, who will teach us about spirit, science, action, and return, how we can leverage this wonderful self-regenerating cycle to do our work better and with greater effectiveness. We'll hear from Jeff, who's worked worldwide in helping organizations and communities find the positive, elevate the positive, tell the truth about the positive, scale the positive, make the positive the norm. And then very dear friend Sharon Hirsch, who is the president of Positive Childhood Alliance North Carolina. She changed the name of the organization, going from Prevent Child Abuse toward what she hoped would be happening, which is creating flourishing for families and children in North Carolina, hence the name change, Positive Childhood Alliance, which is a member of an affiliate of Prevent Child Abuse America. So we're very excited about this conversation. And if anyone has any questions, we've got just a couple of minutes for questions, Jean. I'll say thank you to everyone for being here with us. If you've got questions that we don't get to, please send me an email at CSIP, SIPP at chcimpact.org, and we will get an answer to the questions to you. So let's see if we've got any questions. Someone asked about how we can find out about all of CHC's partnerships and programs in Philadelphia. And that's a great question, and it's something that we're actually working on in the next application to our partners. We'll be asking a question about if they would be willing to let us map where they are, and also to our corporate partners map where they are. So we'll actually have, this is a dream, but a geographic overlay to let people see how they can marry this. Jean, do you have an answer to that as well?
Well, Carrie, first of all, I just want to say how much I love that dream. And I'm looking forward to seeing him become a reality. I think that's an excellent visual for everyone to have. I think the only thing I would just answer in regards to that question is to follow up with Carrie and Shelby. After this call, we can actually let you know who those nonprofit partners are in the city of Philadelphia. So we do have that information that we can actually share. And so please feel free to follow up with Carrie, and then we'll get that information to you. And I love the ideas that's coming from our amazing and innovative team.
Thank you, Jean. Well, The apple doesn't fall far from the tree. As a great innovator yourself, one thing that we may talk about a little bit in the science of the positive is how important it is to feel psychologically safe in the workplace. And by creating a psychologically safe place in the workplace at CHC, which we model to our partners, that's how we get to the innovative ideas that bring us what we hope, which is, again, creating healthier communities. So
Well,
thank
Carrie,
you.
before you thank everyone, I want to just echo what's in the chat from Jess Angel. Carrie, you are an amazing human. Thank you for all you do. So, Carrie, on behalf of all of CHC, congratulations on the first CHC University. I thought this was an amazing success to you and the entire team. I could not agree more with Jess that you are an amazing human being, and we're so grateful for your leadership and all that you're doing here at CHC. I'll turn it back over to you, Carrie, and I'm sure you want to thank our guests.
Thank you, Jean. Thank you. And thank you to our guests for being with us on this maiden voyage of CHC University. We look forward to seeing you on April the 24th at noon. Thank you again. And we'll give you the gift of time by finishing right on the money. Thank you.
Thank you.